I started it about 3 or 4 years ago. We're based over on the west side of Madison. Let's see if I can pull this up here. We based on the west side of Madison. Can everybody see that presentation there? All right, I'm gonna see if I can get this bumped up. All right, now can you see that? Okay. Is that blocked off? Are you seeing the view of the Zoom on that? Is that blocking or is it everything good?
Everybody sees it okay? Give a thumbs up if you do.
Yep, thumbs up is good.
Everybody's saying, yeah, I think you're good.
Awesome. Yeah, so basically Deliver Rehab, we started about 3 or 4 years ago. I started out just doing house calls for people. So we're an outpatient practice, but I started it out, I go into people's homes, I work on balance, strength. After joint replacements, we do a lot of that, Parkinson's, pain management. Started out by just going into people's homes so that they didn't have to travel, kind of as a convenience thing. So we've been doing that for about 3 or 4 years. We've got a few more PTs coming on board. Jason is on the call as well. He's a physical therapy assistant, but he's on the team as well to help out. So that's basically what we do. And then when the pandemic came around, we still were able to see people because of what we do. We really are able to minimize our interaction with our clients that we work with. But as we're talking about today, the virtual options or the telehealth options that came about through this pandemic, Medicare has really opened up what's possible and what they allow for treatment. And we were just in a good position that we jumped on board, and we are now virtual physical therapy providers for the entire state of Wisconsin. So it's a really unique time, I think, in healthcare. It's different. It all kind of came together at the right time for this to be an option, and I don't think this is going away. I think these virtual options, the Zoom videos, all this stuff, I think this is going to be stuff that's going to stick around for a long time until something better comes along. So that's kind of where we are today, but we're going to kind of go through a couple different things. My goal for today is hopefully to make it so that you walk away with some tips on how to get set up for virtual visits with your medical providers. So I see Barb, I see Chuck. I think there was one other person in there. Is that Sally? Fred? Nope. It's Fred and Marge. Okay, and then somebody else at the bottom there. I don't see that. So just show of hands, who's all had a virtual visit with their medical provider in the last year? Yeah. Fred and Marge, have you had a visit at all with the medical provider? No? Okay. Yeah, so for the most part, I've had stuff before in the past. It's really convenient. So hopefully we all have a little bit of an understanding of what a virtual visit is, and it looks like most people do. All right. Now, can everybody see, let's see on my screen here. Can everybody see, it's a smaller group in here. So if you have a question, you can go ahead and raise your hand. Otherwise, we do have a thing I can pull up. If you want to text a question, you can do that. But I think with a smaller number of people, if you have a question or you want to interrupt, that's fine. Just go ahead and raise your hand, and maybe Alyssa can help me figure that out if I can't see people, okay? Jason. All right, so like I said, outline for today. We're going to go over what is telemedicine, virtual medicine. Let's see if I can get this out of the way here. What is it?
I was just going to mention, people can use the chat too, which is super helpful. So feel like you can sure. Type a question in the chat at the bottom too, if you guys need to, if he's in the middle of something, okay?
Yep, and feel free to interrupt too. That's this is kind of an interactive presentation. So if you have questions or comments, feel free to jump in. The next thing, like I said, hopefully give you some tips to walk away from for virtual visits with your medical providers, but also if you're doing visits with family and friends. A lot of people looks like everybody's got the camera at a good distance, and you're all well lit, so it looks like you're on top of the tips, but every now and then you get a friend or a family member that needs a little help, so that's good to have some stuff for that. And then lastly, I'll tell you a little bit more about what we do and kind of our services. All right, so what is telemedicine? Now this is all from the CMS, Medicare, Medicaid services. So it's basically the use of electronic information and telecommunication technology to get the healthcare that you need. And what's really nice about this now during this pandemic and why this has really exploded is because it allows us to keep that distance and still have that communication with your medical provider. All you need is, for the most part, you can do it on a phone. You can do a phone call with your medical provider. That counts as telemedicine or telehealth. But now everybody has access to Zoom or some other, healthcare type video conferencing, and all you need is really a phone or a computer. Everything is pretty accessible now. A lot of times you don't need a special app, so that's kind of nice too for some providers. Speaking with your medical provider, that's always nice. It just opens up the possibilities to ask questions when you have them. Appointments are usually quicker, so you can be a little bit more focused on, what the question is or the concern is that you have, and you can really jump into that subject rather than having to work through a lot of the other stuff when you do go to a clinic. Any questions on that overview? That's pretty generic stuff you probably already know. So yeah, like I said, why is this a thing now? So really it's a way to minimize high-risk individuals especially, but a lot of us, it's just a way to encourage that social distancing, to still safely get the healthcare that you need, but do it at a distance that's safe, but also convenient. So this really all started back in March of last year, 2020. So it was actually kind of before does everybody remember the Friday the 13th? I think that was in March. Yeah, I see a few head shakes. So yeah, that Friday the 13th, that's when the state shut down. We had that state order, I think, was on that Friday, and all the schools, it seemed like everything just kind of crashed at that time. So a little bit before that, on the 6th, the CMS had declared that public health emergency, and they really expanded that access to telehealth before all those shutdowns. So it just was all really good timing that these changes were taking place beforehand. Before that, telehealth was still used, but it was pretty infrequently used. So my guess is, out of the 3 or 4 of you, had you used telehealth before March of this year? I think Barb and Chuck had shook their head. So have you used it beforehand, Chuck? Okay. Yeah, so it was around, it just wasn't as widely used for various reasons. But the pandemic kind of forced people to use it, and I think a lot of people like it. So during this time, since the pandemic started, CMS has added, I guess, see if I get, oh, here we go. So this is the one I wanted to look at. So before COVID-19, before that March 6th time, I think it was, out of everybody in the US, all the beneficiaries, only 15,000 were using that telehealth before the pandemic. So that's a pretty small number. If you look down below at the next part, there's 63 million beneficiaries. So 63 million people in the country that are on Medicare. And before COVID, only 15,000 people were using that telehealth as a service. So very, very, very small percentage. And that was really a lot of people in the rural areas. That's really where it was focused. People way out in the middle of nowhere, and like, South Dakota, Nebraska, Idaho, all that stuff, where it was just hard to get in for an appointment. But yeah, small number there. But since COVID, you can see that number has jumped up to 24.5 million. So like, huge number. And that type of jump would not have happened if it were not for COVID. So Medicare, the SEMA, I can't think of her last name, but she's the head of Health Human Services for the country, CMS. She had a comment that she said the cat's kind of out of the bag now. So regarding telehealth, once all these people have used this service, it's hard to make that go away. So now that all these services are available, it's going to be tough to get back to where I don't think we're ever going to see that number get back down to that 15,000. I think more and more people are going to continue to use these services. So CMS has actually added 144 telehealth services since the pandemic. So things like, you wouldn't have thought of this beforehand, but like an emergency department visit. So they're able to do some screening virtually that can hopefully keep people out of going into the emergency room if they don't need to. So that's a really important one. Inpatient nursing facility visits, that's another one, especially now. A lot of nursing facilities are on lockdown. You can't get into them. So they're trying to just keep anybody out that doesn't absolutely need to be there. So that's been nice for physicians, nurse practitioners that have to go out to the nursing facilities to see those people. It's been a really good option to see them safely without introducing a new person into that building. Different things, pretty much anything that you need through your healthcare management, you can get that virtually now in some form. Now this is a constantly evolving thing, like pharmacy. I think pharmacists are working on getting more coverage through Medicare. So I think that's something that's going to come and change. Physical therapy. So before the COVID pandemic, physical therapy was allowed, but it was really only for those out in the country populations, those rural populations. But that's been a really good change. And like I said, we jumped on that right away because that's kind of something I've always thought of in the past, that this is something that could really open up access to, people throughout the state and throughout the country in a different form than one we typically do. So that's something we'll talk a little bit more about physical therapy, because that's what we do. But I also included here that mental health access has increased significantly as well. So this is my little plug. Social isolation in seniors is a real big deal before the pandemic. So it's even a bigger deal now that a lot of places are shut down. The Verona Senior Center is a great resource for a lot of that support if you need that. But just know that if you need to meet with a psychologist or somebody to talk to, that is a service that is covered a lot through Medicare virtually. So nobody has to answer for this stuff, but I mean, have people had different services other than just their primary care? Yeah, so specialist appointments, a lot of that stuff can be met through there. So we'll kind of touch base. There's a few other, there's a list of different things that you can get access to virtual telehealth wise, but we'll go through that in a little bit. Does anybody have any questions? Yep, go ahead, Chuck.
Are there things that you shouldn't look for through a virtual meeting? Like I need to schedule a physical, and I just am hard pressed to figure out exactly how they would carry that on.
Yeah.
Virtually.
Yeah, that's a really good question. Yep, that's a really good question. So we've run into this a lot with physical therapy, because how do we do things physically if we're not there in person? So to make it clear, the ideal situation is being there in person. That's always going to be the ideal for most cases. It's a completely different thing, and I find that they work well together. So for your question, Chuck, you could always start with the physical virtually, and then if you're a provider, they can go through a lot of different screening questions, and whatever you need to do, they can go through that in questioning. And then if they need you to come in, you can always follow up with an in-person visit. So that's a good way to do it. But there's no clear answer. If it's something emergency wise, like if you're bleeding out of your head, you probably shouldn't do a virtual visit for that. You should probably go to the emergency room, right? Yeah. So that's a really good question. I actually have a point on that later, that it's not for everybody. There's some cases where it's just not appropriate to do a virtual visit. So then in that case, then I would just talk to your medical provider, and they can make that judgment to have you come in then. Does that answer that? Okay. Anybody else? Okay. We'll move on here. All right, so we'll talk about the benefits of virtual medicine. So telehealth, virtual medicine, those are kind of synonymous terms. They're the same thing. Telehealth is kind of an older term, I think. Television, telehealth, I think they were kind of envisioning that. I like to think virtual medicine. That makes more sense to me, but it's basically the same thing. It really allows increased access, right? So you are able to talk to the one person or the two people that you need to talk to, and you don't have to travel to get there. So, a lot of times virtual visits with your doctor or your medical provider, it's really convenient and it's a great way to go if you have like 1 or 2 questions. So if you have something that you want to ask about a medication, if you have some equipment you need, if there's something that you are just wondering about, is this something that I need to pursue further? Like, like Chuck said, if you're not sure, it's a really good way to just open up that discussion. And then if you need to go in for a visit, it's good to follow up that virtual visit with an in-person visit. Overall reduced wait time. I mean, ideally you show up on your computer or your phone and you're there for the visit and then you leave, versus when you go to a clinic now, a lot of times you have to wait in your car. And then, especially if you're going down to the hospital, you have to kind of weave through that maze of getting to an appointment in a different area. So convenience wise, I think it's great. If you can get over the technology side of things and have that set up. So there's also the cost savings too. So if you have to pay for transportation, I don't know if you use like a cab company or transportation, but you don't have to pay for that. So that's always a nice extra thing. Let's see. So when can you use your virtual visits? We've kind of touched base on this a little bit, but basically anytime you need to contact your medical provider for general health questions, that's just a really good option. And I think they like a lot of the physicians and nurse practitioners I've talked with, they like doing this because it allows them really to focus on one-on-one with you as a patient. So I think that's a really good way to go about it. If you're having issues like symptoms, if you're worried about if you've been exposed to COVID-19, that's always virtual is a way to go for that, because then you're minimizing exposure to anybody else. You can ask those questions to see if you need to go get tested or about other medical things related to that possible exposure. So hopefully nobody has to deal with that side of things, but that is an option. Then also the general healthcare stuff. So we'll touch base on this too, but things like managing your blood pressure, if you're watching your blood sugar, those are all things that you can kind of check in with your medical provider without having to physically go in if you have that equipment at home. Also things like if you have like a common rash or things like that, you can show that to them on the camera, and a lot of times they can take a picture of that and save that to your medical chart, and then they can track that if it's changing. It's a really efficient way to do that. Do you have any questions on that? Okay. Big one, prescription medications. If you need a refill on stuff, rather than calling in, if you want to meet with them face to face, you can do that. But also, like I said, calling in to get prescriptions, phone calls count as virtual visits or as telehealth. So that's something that if you have questions, you can always call if you're not comfortable on a camera. Things like nutrition counseling, especially if you're working on diabetes or if you have hypertension or lipid issues, you can always meet with a nutrition counselor, and that's something you could easily do over a virtual visit. That's something not a lot of people think about, but that is an option. And then they can actually see what you're cooking in your kitchen too. So that's a really nice thing. I mentioned before the mental health counseling. So that's something, for all of you that are on here, even if that's something you don't need, you probably know a friend or a neighbor that might be struggling. So that's something good to bring to them and have them reach out to their doctor to see if they can get that set up. So the point of contact for that is if you know somebody that's struggling, have them reach out to their medical provider, their primary care provider, and they can always get that set up. Does that make sense? I got a thumbs up from everybody? Yeah, all right. Marge, where is Fred? Anybody get that?
Marge, you're muted. You got to unmute, my
okay.
dear. There you go.
Fred is occupied with a book right now. It's a Marge visit.
Okay. Sounds good.
But Marge is going to learn, so now we can do this.
Oh, great. That's great. Sorry to call you out there, Marge.
No, we've just gotten a laptop or a Chromebook thing that I could do this with now. So I'm learning.
Yeah. Well, we'll point out what just happened there with Marge, where she left the mute on. So that's something else we'll come back to. I think on tip 9, I have that. We'll touch base on that. All right, so we're going to jump into, these are 9 tips for virtual appointments, and you can really apply these to any, if you're meeting with somebody for fun or playing a card game with somebody virtually. These are some tips. Some of them you can pull into that as well. So the biggest thing is, if you're having questions, if you haven't done a virtual visit yet, I think there were maybe 1 or 2 that hadn't done a virtual visit. You can always call your insurance. If you have Medicare or even like a Medicare Advantage plan, just always call them and ask them if you want to just get that peace of mind to be sure that it's covered. Most of the time it is. Most of the time it is. Just depends on what type of service it is. But then going into those appointments, and this is something I would like you to do for your other appointments as well, even if you're going into a clinic, I always encourage people to have a journal, even if it's just a little notebook that's blank. When you go into an appointment, I want you to write down everything that you're thinking of beforehand and write it down. And then when you go in, you can just hand that over to the person. It's just a really efficient way to get down to what you're having an issue with, and it helps to really focus how that visit goes. And I think when you're meeting virtually, it's even more important, because then you can really efficiently use that time to focus on what you want to focus on. So as a provider, I think most providers appreciate that. If you come in with a mission and you have specific questions, that really is helpful to providers as well, because then it can help them steer that session to that issue. Stating any pre-existing conditions you have. Ideally, you've met with the provider that you're meeting with. It's somebody that you've already met with and they have access to your health records and things like that. But if you're meeting with a specialist, it's always good to go over that other stuff too, just in case they don't have access to your health record. So having that all written down too, if you have a list of all that stuff, that's always important. Here's what I talked about earlier. If you have any medical devices at home, like if you have a blood pressure cuff, if you check your blood sugar, even if you have a pulse oximeter where you can put on your finger and check your oxygen, I would have all that stuff close by, so that way, if your medical provider wants you to check your vitals, you can. So that's a really good thing to do. That way you don't have to run off and find it in the closet underneath the blankets when they want you to check your blood pressure. So have all that in a box or have it on the table ready to go. That's a good thing to do. Like I said, come prepared. So, have that journal beforehand, but also have something to write things down as well. And that's the same as if you go into a clinic visit. If you're at the clinic, have something to write notes on. And it's okay to take notes. And if you need to pause, just say, hey, would you mind pausing for a second? I got to jot this down. That's completely that's the best thing to do, because then, you're going to hopefully remember as much as you can from that visit. A lot of stuff goes by in a short amount of time, just like this presentation. You probably won't remember everything in here. I know Jason won't. So there's a lot of information. It's good to take notes. All right. Keep all your medications handy. So whether that be a list, if you have an updated list of all your medications, all the dosing, that's probably the best bet, is to have that right in front of you. But also, if you have all your medications, in a nice spot together, that way, in case there's an adjustment to your dosage, or, you can make a note right on that list or right on that bottle if you need to. So have all that ready to go. Just generally, it's good to keep track of all your medications anyway. So having that as organized as possible is always good, and have it ready to go. Like we talked about before with Chuck, virtual visits are not for everybody. Sometimes you have to go into a clinic, and that's okay. It's fine to do a virtual visit first to make that determination. That way you're not going into a clinic and then they say, oh yeah, this is something you could have done from home. Just kind of, I would do that first and then move on. So with us as physical therapists, we do house calls. We go out to the house still. That is still something we do a lot, primarily for people with balance issues. So, if we're working on balance issues with somebody, we want to challenge them. And that's not always the safest thing to do when I can't be there to make sure they're safe. You know, you kind of need to be close to monitor that stuff. So that's something where, you know, I've had people where, you know, they come on and they just aren't appropriate for virtual visits. And then if they're within, you know, driving distance of Madison, we can go out and see them, and we don't lose any coverage. It just kind of transitions that way. Another thing that we do too is we can kind of do hybrid visits. So I've had people way outside of Madison, like Mauston area. I've gone down to Janesville area, and what I'll do is go down for an in-person visit for the evaluation. I can go meet with them, and then we could do follow-up visits with our virtual system. I'll get them set up and make sure they're safe with things, but then we can do follow-up visits. So that's something you might be able to do with your other medical providers, as well as, you know, when you go to a clinic visit, ask if there's a way you could just follow up with a virtual visit. So that way you're able to minimize your travel time too, if you'd like to. Does that make sense to everybody? It's kind of all included. It's not one or the other. You can do both. All right, this is the most important stuff, I'd say. So when you're trying to get a good virtual visit, the most important thing to do is have wood paneling behind you, as you can see behind me here. So that is ideally the best environment for a video call. So we're in our office is actually in an older building. It's a great office, but we have wood paneling, which I like. So biggest thing is you want to be in a quiet environment, right? So, you know, if you have kids running around or something like that, try and get to a quiet spot so that you can hear and that they can hear you when you're talking. Have the light in front of you if you can. If you have that light behind you, it's hard for them to see you. So trying to just make sure that the lights are on and that everybody can see you and you can see the provider. If you have a computer, that's ideal. If you have a laptop, you know, that's probably the best option because the screen is bigger for you, but then also you can keep that camera, you know, try and keep it 3 to 4 feet away if you can, so that way they can see all of you. Especially, you know, if you have a rash on your arm and you need to have somebody check that out, you need to make sure you're far enough away that they can see that appropriately. So if somebody's working with us, that 3 to 4 feet away, then we can really look at, you know, what's your range of motion look like? When you stand up and sit down, what does that look like? How are you able to do that? Are you compensating? You can get a lot of that just by video if you have it set up appropriately. So that's kind of the best practice for that. And then the last thing is, if you're talking with your medical provider, it's always good to make sure you're in a place that your privacy is protected. You know, if you're talking about something that's private, you might not think about, it's hard when you go to a clinic, it's private, right? You're in a private room, everything's confidential, but when you're home, there's some things you never know who's on the phone in the other room. So if you need to, make sure that you go and get in a private spot. You don't know if Fred is listening to you, Marge. I don't know if she heard that. Well, we'll move on. Best to prepare your device beforehand. So if you're using a computer or phone, make sure you're charged up. That happens quite a bit. You're halfway through and your battery dies. That happens all the time. So if you can, plug it in. Just keep it plugged in. Make sure that's good. Like I said, computer and tablets are better than phone just because they're bigger. The cameras on phones are much better nowadays than computers, which is always good too. But then your screen is smaller for you. So whatever you're comfortable with. Make sure your internet connection is good. So, you know, if you have one spot in the house where that's the only place you get internet, that's where you probably need to go to make sure your connection is good. And then if possible, try and test the system out before your appointment. So a lot of places, they'll do like a pre-call to get you set up. For those of you that have done a visit, have you done like a test call with a nurse's aide or anything like that? No? So yeah, some places will call beforehand, like 15 minutes ahead, just to make sure that you're set up. And then, you know, at that time, you know, your doctor or nurse practitioner or nurse can come in. So that's something to always do too. If you're able to, if you need an app for this visit, make sure you get that app on your phone or check your email. We actually use a system called Doxy.me. It's a healthcare system. You don't need to download an app, and the address is always the exact same. So you basically come in and you you check into our clinic and it's always the same link, so you don't have to download anything, which is good, and it's a secure system. But I know a lot of people use Zoom too, so you obviously are able to use Zoom, so that's good. But some people might have a hard time with that if they don't have Zoom on their computer. So just working through those issues. Other things I don't have on here, but making sure that your microphone is on, not on mute, making sure your camera is on. So that's stuff that, you know, hopefully beforehand you can kind of figure that out if you do a test run. So that way at 10 o'clock when you're supposed to meet with your doctor, you're not trying to figure that stuff out, and hopefully it's just good to go. All right. Anybody else have any comments or things that have gone wrong with a virtual visit? No. Another big thing, this is something I didn't put on here, but something that's really important too is camera angle. So make sure when you're looking at your camera, you all look like you've done a great job. So way to go. But you know, making sure your camera isn't pointed up at the ceiling and all you see is your head on the bottom. So that's, even if you know, you might be 6 feet away, but if your camera is pointing up, they're not going to see anything. So taking the time, just make sure that you're set up good is always important beforehand. All right. So that's pretty much it for the tips. You know, telehealth tips, tips for video calls. You can use that for family calls too. It's good to make sure your device is set up when you're meeting with your grandkids, you know, so that it doesn't drop. That's all stuff you can carry over. But like I said before, I don't think virtual health is going away. I think a lot of people don't like it, but I think it's here to stay, and it's going to continue to be an option for a lot of people. I think there are better things coming as well. So virtual reality, is anybody familiar with virtual reality? So this is just kind of me guessing into the future to see what's coming, but you know, there's stuff coming where they can reproduce a 3D image of you at their office with these special goggles. You know, so that stuff is going to come. Yeah, so I mean, I think there's going to be a lot more changes coming in the future. Things like medical devices, like your Fitbits, your Apple Watches, that stuff is not cleared for medical use, but I do think a lot of that home devices are going to come into play for us to better track things with your medical providers. So it's kind of an exciting time. It's like the Industrial Revolution for healthcare, I think. So it's kind of an exciting time to be here. Does anybody have any hesitancies before I move on, does anybody have any like hesitancies or concerns with virtual healthcare? Or any questions on it?
Yeah, I just want to say that I've had a number of physical therapy virtual visits, and
Yep.
To me, that is really a great application because they can, you know, ask you about specific joints, have you do some exercises and watch you do it, make sure you're doing them correctly. And then afterwards, email you the sheets with the exercises on them so that you don't forget.
Yeah, absolutely. Yeah, I think as physical therapists, a lot of the times, basically what we do is we're kind of encouragers and there to keep people accountable. So a lot of that stuff we can just do by meeting with people and just say, hey, how's it going? What do you have questions on? So, you know, there's a lot of stuff we can do with video, and I'm glad to hear that you're doing that stuff because I think you should take advantage of it if you need it. So great. Thanks for sharing, Chuck.
You bet.
All right. So I'll move into here. So like I said before with Deliver Rehab, so, you know, we're based out of Madison. We're a hybrid company now. We weren't when we started. We were a strictly in-person house call visit company. But now we've kind of become a hybrid company. I think embracing the change and kind of looking ahead. Not a lot of other places are really focusing on that virtual option. So that's what we are. We do both. And the virtual option has really expanded our territory. We see people all over the state with this. So it's really nice. It's within our license is good for the whole state. So that's really expanded our options for seeing people. we're networked with Medicare B, Medicaid, My Choice, Care Wisconsin, iCare, Humana, United Healthcare. So those all cover services with us. And pretty much, you know, pretty much any Medicare plan will be covering virtual services with somebody, even if we're not in network with it. If you've worked with a therapist before and you're in network with them, like Quartz and Dean, we're not in network with them, but if you have questions or if you have stuff you've worked on before, I would encourage you to reach out to them to see if they can help you. Because most places are doing this now as an option if you request it. So for our in-home stuff, if we're going out to the house, we still do primarily balance, weakness issues, pain management, joint replacements. There was a little bit of a hold on that. They pushed pause on joint replacements because of the pandemic, but that's coming back, and we're seeing those people. And a lot of that stuff you need to be hands-on for at least the first visit. So that's something we're still doing. But then, like I said, we're still doing the in-person, but then we can follow up with those virtual visits. That's an option as well. So yeah, like Chuck, even if you're working with somebody, if you want to do a virtual visit instead of going in, that's always something you can request if they have that option. So go ahead and ask around. Virtual, you know, a lot of the stuff we focus on is like shoulder pain, just because that's such an easy joint to look at. With a camera, we can see a lot of stuff going on. If it's weakness, if you're tight, we can do a lot of exercises from a distance, hands off, and you don't need a lot of equipment to do exercises for your shoulder. You can use a table, you can use a cane, you can use soup cans. There's a lot of stuff you can do for that. A lot of stuff we're doing now too is that TMJ pain. So a lot of people get pain up in this joint up in here. That's something not a lot of people think of as a muscular joint thing, but this is a joint up in here, and a lot of people get pain up in there, and it's actually a really good one to treat virtually. So that's an option. Otherwise, back pain, general weakness stuff, those are all things we can help hopefully encourage you with virtually. Yeah, if you're looking for physical therapy, the best place to go is always to talk to your doctor or your nurse practitioner, whoever your primary care provider is. Just go ahead and give them a call if you need therapy. They're always the person that you can go to. But to work with physical therapy now, in most cases, you don't even need a referral. I encourage people, if they're questioning, just go ahead and get a referral, because it's always helpful to make sure the primary care provider is on board, which I've never had an issue with. They're not on board. This is just our system. If you ever want to check out our system, you can actually go to that link there, that deliverrehab.doxy.me, and you can actually log into our clinic and just look at it if you want. It's not super exciting, but you can just see like how that would look. It's pretty similar to Zoom. It just gives us a few different options. And then this is something on the bottom here, that one on the bottom. Not all places are doing this, but you can always ask around if you have somebody you've worked with in the past and you're still seeing them. For virtual visits, Medicare has allowed providers to waive copays, co-insurances, and deductibles until the end of the pandemic. So that's kind of a neat thing too, that normally we can't waive those as providers. We can't say, you know, we won't charge you that deductible. We can actually lose your license for that. But during the pandemic, they've allowed us to waive that. So that's something too. If somebody has a copay, that shouldn't be a barrier to getting therapy. All right. So I think that is it. So thank you for staying through to the plug at the end there. But hope you all have a great day. Any questions?